Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino, and welcome to this week's edition of the Chiropractic Research Breakdown, where each week we empower you with the ammo and certainty necessary to change the health of your community from the inside out. I'm really excited about 3 different articles we're going over today. All of them make me happy. First is going to be looking at taking care of babies and whether or not chiropractic care as an infant can actually help prevent migraines. That's exciting. That was research that was discussed at the ECU Convention Conference in Budapest in 2018. We're going to go ahead and look at, for our Heart Health Month, a case study from a chiro warrior, Eric Zielinski, looking at changes in cholesterol and cardiovascular disease risk factors following subluxation-only care using the torque release technique. And then we're going to look at research on active duty military in military hospitals, looking at whether or not including chiropractic care is actually beneficial versus medical care alone. So we're going to go ahead and start looking at the ECU convention. Before we do that, as a reminder, you guys can get this information both in social media format as well as in patient newsletter format. You can get that to your inbox at ChiroEdgeMedia.com. So we're going to go ahead and start from this ECU Convention Conference proceedings in Budapest 2018. It's called Migraine and Pension-Type Headaches in Former Colicky Babies Treated by Chiropractors, a Prospective Cohort Study. So they look at how headache literature points to relationships between infantile colic and later migraines. Something I did not know is that 23%, according to Finnish research, 23% of former colicky babies have migraines at age 18, compared to 11% in former non-colicky babies. Or if you look at it, it's 23% in kids who were colicky versus 15% of the general population of everybody, which is nuts. I didn't know that there was that difference. So what they decided to do is they looked at individuals who had been under chiropractic care at less than 12 weeks old. So they found anybody who had gotten adjusted very gently and specifically at earlier than 12 weeks old for or with colic. Obviously, parents go and heard chiropractic care can help with colic. They reached 269 people based on their criteria. And of those 269, only 12% had migraines, which was, if you look at the statistical numbers, 80% lower than what the Finnish researchers reported. So you have about an 80% decreased rate if you had colic as a baby of getting migraines later in life than you would have, which is awesome. Why would this happen? Birth trauma, birth trauma, birth trauma. We know that by being born, we're putting a lot of pressure and tension on the head and neck, and then as the shoulders come through, we get yanked. So, if we can gently and specifically correct subluxation at the top of the neck, take tension off of those nerves, allow the body to heal and function, allow for the proper restoration of communication between the brain and the body, is going to affect all of our growth and development. Colic oftentimes is a result of an improperly functioning nervous system. So are migraines. So it's not saying that this is a treatment for colic. It's not saying this is a treatment for migraines, but simply by saying is that if we know that one of those two things are there, chances are the nervous system isn't functioning at 100%. So make sure that your community knows is that if any of these things are present, it's not only important, it's just especially important to get this checked to make sure that they are going to heal and they're going to function at 100% of their best. Excellent. Next, from the Annals of Vertebral Subluxation Research, Eric Zielinski is a chiropractor I went to school with. He graduated a little bit ahead of me. He was always like a research junkie, research warrior, definitely just really, really well published, big into writing. I think he was writing for Dr. Axe for a little bit as well. And it's called An Epidemiological Approach to Subluxation-Based Chiropractic Care and Cardiovascular Disease Risk Factor, a case study and review of the literature. Dr. E, man, if you're out there, reach out to me, dude. I want to see how you're doing. This is a good study. I read this before when we were in school, but this is really good. So he starts off, he does a really super thorough history and breakdown of cholesterol and cardiovascular disease. It's like 10 pages. Please, if you are interested in cholesterol, the history of cholesterol, statins, he does such a good job just breaking it all down here. In the interest of time and getting started for our day, I'm not going to go through all of it. But he does a lot of challenging of a lot of medical thinking on cardiovascular disease. For example, just like one paragraph of these 10 pages of ripping apart statins. 1/6 of Americans suffer from high total cholesterol, which we're told is a huge risk factor. And that was back in like the 60s, and that number has dropped by more than half. Yet over that time, while cholesterol was dropping, cardiovascular disease was still on the rise. He goes through lots of supporting evidence from different studies from different countries on why cholesterol isn't the problem. But if you're into that stuff, it's just a really great read. Again, it's called An Epidemiological Approach to Subluxation-Based Chiropractic Care and Cardiovascular Disease Risk Factors, a case study and review of literature. So enter the case study itself. 54-year-old man. Check this out. Dyslipidemia, anxiety, constipation, fatigue, irritability, mood swings, neck pain, stiff neck, and depression. Does this guy sound subluxated enough for you? Has a history of angioplasty, double hernia surgery, exploratory lung surgery, hydrocele correction, and 3 rotator cuff surgeries. He was diagnosed and started taking medications for high cholesterol 12 years prior to he ever experienced a heart attack. So it looks like that stuff was really working for him, right? So they used the insight to evaluate. They adjusted him using torque release technique over the course of about 4.5 months. If you guys are not familiar, it's a tonal instrument-based technique, utilizes leg checks known as functional leg length reflexes and pressure tests. It's very gentle, very specific. Majority of times, without education, a practice member will get off the table and say, "That's it." Yeah, let's see what the correction we got. 4 months into regular care, patient had another lipid panel, and they had dropped significantly. His total cholesterol went from 124 to 104. His LDLs went from 63 to 43. His HDLs went up from 38 to 44. And his triglycerides dropped from 116 to 83. His cardiologist said, quote, "Your liver functions and CPK were within normal limits. Your numbers looked great. Keep up the good work." She then advised him to continue taking Tricort daily, Welchol 3 tablets daily, and Vytorin only until his supply ran out, and changed to simvastatin, which is a more conservative medication than what he was taking. This is my favorite part. Get ready for it. It is vital to note that, according to the patient, no other lifestyle changes were made during the 4.5 months. 1 month after receiving care, he wrote in a wellness program analysis, "I feel so much better and relaxed." They used the insight. They saw huge changes from going from being in a chronic sympathetic state to parasympathetic, or to more balanced state. It's amazing what happens when we correct subluxation, and it shifts us there. This is absolutely amazing. This is exactly what we want to see. Make sure you read that, because he dives deep into the inflammation process and how subluxation relates to that, and it's something that's really valuable for you. So we're going to close with effective usual medical care plus chiropractic care versus usual Medicare alone on pain and disability among U.S. service members with low back pain, a comparative effectiveness clinical trial. Low back pain is one of the most common reasons military service members seek medical care, and one of the most likely conditions to interrupt combat duty. This is from the Open Journal of the American Medical Association. They say the U.S. opioid crisis creates an urgent need to evaluate cost-effectiveness and low-risk non-pharmacological treatments. Chiropractic care is currently, at the time of writing, available at 66 military health treatments facilities worldwide. 66. Unbelievable that that's how few there are. And shows promise in treatment of acute low back pain. So they looked at care provided at 2 large military medical centers in Bethesda, Maryland, and San Diego, and a smaller one in Pensacola. 750 military service members were selected. Half were put into the regular intervention group, which included just self-management advice, pharmacological pain treatment, PT, or pain clinic referral. And then half did all of that, plus chiropractic care. As many of 12 visits throughout 12 weeks, which is nothing. Spinal manipulative therapy, again, it's in JAMA, so, of course, chiropractors are going to do whatever they can to get it in there. So they're going to say SMT. In the low back and adjacent regions. They said treatment decisions regarding manipulation type, location, and direction were based on patient diagnoses, based on their evaluation. This is nuts, because even in JAMA, in the Journal of the American Medical Association, the research that published is still more specific than the nonsense that comes out of the Journal of Chiropractic Medicine, where we just randomly manipulated the atlas. Yes, I am still bitter about that. Please do a flippant evaluation when you do research. Find a vector, find a location, and adjust it appropriately. If JAMA can do it, you can do it. So also included there was rehab exercise, interferential current therapy, ultrasound therapy, cryotherapy, superficial heat, and other manual therapies. Hate that they're including that with chiropractic, but since PT was available in the regular group as well and chiropractic was not, I'm assuming that since those things, rehab, interferential current, ultrasound, cryotherapy, superficial heat, and other manual therapies, since those are actually physical therapy and not chiropractic, I don't know why they're mentioned because they should be available to the physical therapy group as well. So over the course of 12 weeks, which once again, the people could receive a maximum of 12 chiropractic visits, they found that both usual medical care alone and usual medical care plus chiropractic care saw improvements of low back pain and disability. However, overall numbers and at every location, what they found was significantly better improvements in people who had both usual medical care and chiropractic care over usual medical care alone. They also had a greater satisfaction rate. So take that with you. Know the amazing change you're going to bring to your community this week. Once again, I'm Dr. Anthony Pellegrino from ChiroEdge. This was another week of your chiropractic research breakdown. Jump on ChiroEdgeMedia.com so that you can get all of this information in patient newsletter format for a 2-week trial straight to your inbox every Sunday night. Thank you. I love you. Keep slaying those subluxations.